My name is Nyla. I am 6 years old and I visit my dentist twice a year. My front teeth, they are called incisors, and my back teeth, they are called molars. I am getting my first permanent molars. I can now have sealants. Join me to learn more about my teeth and how I keep them happy and healthy.
Hi, I'm Dr. Nadia. I'm going to share some information about teeth and oral health today with you guys.
Hi everyone, my name's Dr. Jamal Wells and I'm excited to teach you all about teeth today.
Hello, I'm Dr. Deanne. It's really so nice to meet you. Hi. That was my dentist, Dr. Deanne. My baby teeth are also called primary teeth, and they have names from the letters in the alphabet. Do you know your alphabet like I do? A, B, C, D, E, F, G. These are your first set of teeth, so take very good care of them. They're holding the space for the permanent teeth. Now that I am growing up, I am getting my permanent teeth. They can also be called adult teeth, and they have names by numbers. They are your forever teeth, so make sure to take very good care of them. Now that I'm getting my grown-up molars, I can have dental sealants. When I go to the dentist, they're going to paint the sealant on my grown-up molars to protect them from me. It's very easy. They help to keep your teeth healthy. I know you brush your teeth. When you're brushing your teeth, you can brush round and round in circles gently. Tickle your teeth and tickle your gums. Clean every single tooth thoroughly and brush twice a day. When I brush my teeth, I use just a little toothpaste, the size of a pea, and I don't swallow the toothpaste. Don't swallow the toothpaste. You can use a soft toothbrush, that's best, and rinse it off really well when you're done. Dry it and store it standing up. I heard a really funny song. It goes, brush at night to keep your teeth, brush in the morning to keep your friends. I know, nobody wants a stinky breath in the morning, right? So remember, brush your teeth round and round in circles, tickle your teeth and tickle your gums. Don't forget to get the ones in the back, and brush your tongue when you're all done. Perfect. Good job, Dr. Deanne. I always brush and floss before I go to bed, and I rinse with water. Remember, your toothbrush, toothpaste, and dental floss, they are like tooth defenders. And the dentist says the most important time to brush your teeth is just before going to bed. If you need to sneeze, you can sneeze into your elbow. Make it like a chicken wing. And always wash your hands. And no thumb sucking like Linus. That's not good. Thumb sucking can make your teeth grow upwards and outwards and crooked. Look at this picture. No nail biting, because nail biting can chip your teeth or change the way they come in. And you might be putting dirty fingers in your mouth. But you can floss. Flossing is good for your teeth. Let's take a look at Dr. Deanne. She's going to show us how to floss. And maybe she'll do the floss dance. Do you know the floss dance? Well, boys and girls, this is the way I floss. Dun, 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 dun. Get a nice piece. But this is the way I do the floss dance. I hope you like healthy snacks like fruits and vegetables. They are good for you. and good for your teeth. Chips and juice and soda pop can spoil your teeth and make them rot. Be careful with unhealthy snacks like chips and sticky candy and soda pop. Even gummy vitamins can cause cavities. And remember my song, chips and juice and soda pop can spoil your teeth and make them rot. So do you want to pretend to be a dentist at home? Do you have any toys at home? I do. I have a toy dinosaur and a baby shark. Which one should be our patient? The baby shark? Awesome. Now you need to pretend you're washing your hands really well, as a dentist does. Put a mask on so that if you sneeze, achoo, you won't spread your germs. And if the shark sneezes, achoo, he won't spread his germs to me. Then put some special gloves on. One goes on your right hand with your 5 fingers, and the other goes on your left hand with 5 fingers. You can even pretend to put safety glasses on. Then let's get our patient. It's a baby shark. We're going to take a look at the shark, lay him down and put his bib on. There you go. And then we'll check his teeth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I found the cavity. Let's clean it up. It's right there where the chocolate chip cookies and the gummy vitamins got caught. All better now. There you go. You pretended to be a dentist, and it was fun. Now here's a picture of my dental friends at my dentist office. They love doing the floss dance too. Next, we're going to watch my friend Anisha as she makes a visit to her dentist office. And after we watch my friend Anisha and her dental visit, there will be additional information for parents and other adults. Maybe I will see you at the dentist office during your next visit. Take care, and let's keep our teeth healthy and happy.
Hi, my name is Anisha. Last week I had a dentist appointment at the Royal Children's Hospital. When we arrived at the hospital, we went to the dentistry clinic on the ground floor, just past the gift shop. Mum checked us in at reception.
Good morning. How are you? We have a 9 o'clock appointment for Anissa today.
We had to wait for our turn to be seen. Pretty soon, Jazz, the dental nurse, came out and took us to meet the dentist, Sarah. I sat on a comfy chair and Sarah asked Mum a few questions.
Does she have any allergies? No, she's fit and healthy.
Jazz gave me some sunglasses to wear. The lights in here were pretty bright. Sarah had to get ready too. Next, she lowered the back of my chair so she could look at me more easily. She checked my head and neck. First, she showed me the tools she would use.
First, this is the mirror. Okay, do you mind holding it, please?
And I got to hold and feel them.
And the next instrument is called the probe. It's used to count your teeth. So we go like this. 1, 2, 3.
Then it was time for Sarah to look in my mouth. I opened my mouth as wide as I could to make it easier. She used the little mirror and the probe to look around my mouth and check all my teeth. This felt a bit strange, but it wasn't too uncomfortable.
Are you doing okay, Nisha? Excellent.
Next, Sarah showed me the best way to brush my teeth at home. to make sure I keep my teeth really healthy.
We're gonna clean your teeth with a special dentist toothbrush. Let me show you on your fingers if I tickle a little bit. Does that tickle? Yeah.
Sarah gave my teeth a really good clean.
Tickles a little bit on this side, huh?
She also flossed between my teeth. After this, she painted something called fluoride on my teeth. Fluoride helps to keep my teeth strong.
Now, Anisha, I'm gonna sit you up, okay, so we can take some x-rays.
X-ray pictures help Sarah see inside and around my teeth.
I'm gonna give you a kiss on the cheek. Hi, do you wanna try?
This is the X-ray camera. I wore an X-ray proof blanket so that only the pictures of my teeth are taken. She put a little film in my mouth, and then I had to clench my teeth together and keep super still. Everyone had to leave the room because Sarah only wanted a picture of me.
So now, Anisha, we're just gonna have to step out. 1, 2, 3, 4, 5. Good job.
Then it was all done. Sarah checked the X-ray pictures on her computer and said everything was okay. And best of all, I got a really good present for being brave.
Bye, Anisha. See you in 6 months.
Bye!
Hello, it's Dr. Deanne again with healthy tips for the parents and other adults. Help your children keep those baby teeth or primary teeth clean and cavity-free. They are so very important. If you have any questions or concerns about what you see, just call your dental home. Good nutrition is important for healthy teeth and for healthy bodies. Plaque removal by toothbrushing and flossing can prevent cavities. Practice those good habits and good preventive care. Help your child to not thumb suck or bite their nails. Remember that nighttime brushing is most important, and make sure to have a dental home for routine and urgent care. Now let's hear from Dr. Nadia and Dr. Jamal.
Hi, my name is Dr. Nadia, and I wanted to talk to you about the number of the teeth that are present in the mouth. So we have 20 baby teeth and 32 adult teeth. Baby teeth are holding space for adult teeth, so it is very important to keep them nice and clean. When baby teeth and adult teeth are in the mouth together, it is known as mixed dentition. It means a mix of teeth and a mouth. So by the age of 6, you'll notice some adult teeth are coming in, like the back molars and the front incisors. Baby teeth wiggle out, it's called exfoliation, and adult teeth come in, it's called eruption. Whether it's a baby tooth or an adult tooth, please help your boys and girls to keep them nice and clean. I talked about different types of teeth before, the baby teeth and the grown-up teeth. Now I want to talk about when things look different in the mouth. That's called anomaly. I'm going to give you different examples, and there's nothing to worry about if you notice any of these anomalies in your child. You just have to make sure you see your dentist to get consult or advice if necessary. Fusion or gemination means when two teeth are joined together. If you notice this condition in your child, the only thing you would want to look for is the groove where the two teeth are joined together. It is important to keep that groove nice and clean to reduce the risk of cavity formation. Enamel is the outer layer of tooth. When you have enamel hypoplasia, the teeth might not appear as perfect white as you normally expect to see. You can see your dentist to get consultation in regards to the discoloration. When your child with enamel hypoplasia is a bit older, then she or he might be ready to get aesthetic treatment done to mask the discoloration. Anterior crossbite means when the lower front teeth are overlapping the upper front teeth. This can be fixed by getting a retainer. Ectopic eruption means when the baby tooth is still in the mouth and a grown-up tooth is coming in, away from the spot it should be there. So you can see in this picture, the lower front teeth are remaining and the grown-up lower front teeth are trying to come in the back. Once the baby teeth fall out, the adult teeth will be pushed in front by the force of tongue. Supernumerary is when you have an extra tooth. We usually would wait until the child is older to take or remove the extra tooth out unless it is causing some discomfort. Patient's tongue in this picture looks different because it does have different patterns on it, which moves from one spot to another spot. That's why it's called geographic tongue.
Hi again, this is Dr. Wells here. So let's take a minute to talk about a few terms in order to make sure we all understand things a little bit more clearly, and you could also see them listed here below. So to start, anterior crossbite. This is when your lower teeth cross over your upper teeth when an individual bites down, and it's sometimes also called underbite. Anomalies are when something deviates from the norm or from what we expect. A cavitation is when there is a hole or a cavity that is formed in a tooth. Eruption is when a new tooth is coming out of the gums, and exfoliation is when a primary tooth or baby tooth is being loosened and on its way out. Gemination is when two teeth develop from one, and this can be compared to fusion, which is when two teeth are fused as one. Geographic tongue is a harmless patches or that may appear on an individual's tongue. These can often change locations and may sometimes be itchy or painful. Mixed dentition is when primary and permanent teeth are present within the mouth at the same time. A sealant is a material that dentists can place within the grooves of permanent teeth in order to prevent decay and future cavities. And supernumerary teeth are an anomaly present when there is an extra tooth from the normal in the mouth. Hi again. So, as we know, a well-balanced nutrition is important to our growing bodies. And oftentimes it may help to give children vitamins in order to make sure that they reach those nutritional goals. But as we think about it, it's important to notice that gummy vitamins can stick on teeth, and by doing so, they can stick there just like candies do and cause bacteria to grow on our teeth. So even though it's important to have those vitamins in children's lives, it may be a little bit better to try and provide them with chewable vitamins instead of gummy ones so that they don't always stick, and that way you could prevent cavities from forming a little bit easier for them. But next we'll talk a little bit more about cavities, okay? So guys, I hope you're ready to talk about cavities now. Now, cavities are caused by bacteria that normally live within our mouth. When the bacteria gets a chance to interact with foods and drinks that we eat, it can form acids. This acid can cause our teeth to be broken down, causing a hole or a cavitation or a cavity within our teeth. Now, it's very important to do whatever we can in order to prevent these cavities from forming, and thus there's a lot of things that you could do initially to prevent that, as well as things that dentists may have to do afterwards in order to make sure to get rid of that cavity and thus prevent future pain. Hi again, so now let's take a minute to talk about a general dental treatment plan. As you may know, it's very important to go and see the dentist every 6 months, and during this time we'll often do cleanings as well as take x-rays for patients. It's possible that when taking these x-rays we may notice cavities on your teeth or cavities in between your teeth. And if that occurs, then it's very important for us to move forward with some dental treatment, which may occur on the same day or a different day. Sometimes it may be beneficial to do some sort of sedation or treatment under general anesthesia for the patient, just if it makes them more comfortable, and that's definitely something able to do at a lot of dental offices. After that point, as long as you're cavity-free, you can continue on in the cycle of 6-month recalls in order to make sure that you keep your teeth clean and no future cavities are formed. So next we'll show you a little image of the new Oshai Hospital, and we could talk a little bit more about what occurs there too.
Shadow Shine Children's Hospital. Today we're going to show you what it's like to visit the dentist in an operating room.
First, you will go through these doors, then up these elevators to the second floor. Then to this room. This is the waiting room where you will wait for your appointment. When your name is called, you will walk into another room. You will go into a room with a special bed with wheels. Now the nurse will help you get ready for the dentist. Once you're ready, they will bring you back into another room.
Welcome to the operating room. In this room, you'll see a few big bright lights. This will help the dentist see in your mouth better.
This machine helps you sleep and keeps you safe. There will be a lot of people in the room welcoming you. Now it is time for you to get on a new special bed. Once you are on the bed, the nurses in the room will put stickers and a bracelet on you. This is fun, and the nurses are very gentle. Once you have all your stickers and bracelets on you, you will get to fill up a big balloon using a mask that smells just like berries. You will start to feel tired and want to take a nap. Sweet dreams! Once you wake up, you will be in another room similar to where you started. You might feel tired still.
Once you start to wake up a little more, you'll be all set to go home. You went to the dentist. Great job!
Hello, it's Dr. Deanne again. That was a great example of a children's hospital reserved for dental treatment that is complex or that cannot be handled in a chair. Now for some preventive care and good habit reminders. Dental sealants are placed to guard against cavities, and that's done on adult molars. It is done in the dental office by the dentist or the dental hygienist when the child is 6 years of age or when the first permanent molars come in. Fluoride is placed at the cleaning appointment, and those appointments are typically every 6 months. It can be painted on as a varnish or placed in a foam tray. Fluoride also prevents cavities from forming. Good nutrition is a great habit and can be made into a family affair. Remember to avoid the gummy snacks with the kids and the gummy vitamins. They can stick on your children's teeth and break the enamel down, causing cavities. The whole family should drink tap water. It cleanses your teeth and contains safe doses of fluoride. And water is a great choice for your children and for yourself as the last thing before going to bed. Especially with the children, avoid having them take juice or milk to bed, and try to discourage thumb and pacifier sucking. I'm going to use this opportunity to talk about thumb sucking. The American Dental Association and the American Academy of Pediatric Dentistry both state that thumb sucking and pacifier sucking are a natural reflex for babies and for very young children. As a pediatric dentist, we would really like that the children stop the habit between the ages of 2 and 4. Feel free to ask your dentist some ways that you can help your child. One tip is to share praise when your child is not sucking their thumb. Children often suck their thumb when they're feeling insecure or needing comfort. So focus on correcting the cause of the anxiety and provide comfort to the child. And you can always ask your dentist to offer encouragement. So we're near the end of our presentation. It's a good time to talk about nighttime brushing. Nighttime brushing and brushing just before bed is best for healthy teeth. It helps to protect against plaque buildup and result in tooth decay. You see, when you're sleeping, your mouth gets very dry and there isn't the natural saliva to wash away the plaque. So brushing just before you go to bed, rinsing with water, and if you're thirsty while you're sleeping, make sure it's water that you're drinking. While we know it's optimal to brush your teeth both in the morning when you wake up, and with the kids, we had a nice little song for them about that, we know that at night before going to bed is the most important time to brush. As the presentation comes to an end, here are a few more reminders of oral health. Remember that oral health is the window to the health of the entire body. It is essential for total health. It is often overlooked until there's pain and extensive damage. It is important to establish in early childhood. It is easily achieved and maintained, and it is an instrumental aspect of a healthy and happy life. And so on behalf of Dr. Jamal Wells, Dr. Nadia Latifi, and myself, Dr. Deanne, I'd like to say thank you, and I hope this was an informative presentation. I'd like to also say thank you to Catherine Lewis for inviting us to be a part of her dental team. And a very special thank you to Nyla for sharing with us how to achieve healthy and happy teeth.
Great teamwork, everybody. Thank you all so very much. On behalf of the Erie County chapter of the Lynx, and in partnership with Dr. Deanne and her team at University Pediatric Dentistry, it has been our pleasure to bring this program to you today. Remember, healthy teeth are happy teeth and will help to keep the whole body healthy as well. Take care and be well.